Hello and good morning, everyone. I'm Rima Stanley, tutor at Triple M College of Nursing, Department of Mental Health. In this video, I'll be discussing about nursing care of patients with acute mania. What is mania? Mania is a mood disorder which has a central features such as overactivity, mood changes, which may be towards elation or irritability, and self-important ideas. What is acute mania? So acute mania should have the following features which should be lasting for at least for 1 week. This include elevated mood, expansive mood, irritable mood. Elevated mood has four phases. The phases include euphoria, which means an increased sense of psychological well-being and not keeping with ongoing events. Elation is a moderate elevation of mood with increased psychomotor activity. Exaltation is an intense elevation of mood with delusion of grandeur. Ecstasy is a severe mood elevation with increased sense of rapture or blissfulness as seen in delirious and stuporous mania. Expansive and irritable mood. Expansive mood means is an unceasing and unselective enthusiasm for interacting with people and the surrounding environment. However, irritable moods is seen sometimes, especially when the person is stopped from doing what he wants. Psychomotor activity, it is usually increased with mania that ranging from overactiveness and restlessness to manic excitement. The person tend to involve in ceaseless activity, and these activities are goal oriented and based on external cues. Speech and thoughts includes flight of ideas, pressure of speech such as punning, rhyming, delusion of grandeur, delusion of persecution, and other features such as increased socialization, impulsive behavior, high risk behavior like involving in reckless driving, foolish business investment, buying sprees, etc. There is also a decreased sleep due to hyperactivity, poor food intake, and poor attention, judgment, and poor insight. Now, let us see the nursing management of patient with mania. This starts with the nursing assessment, which involves a complete history collection and a mental status examination. Here are the possible nursing diagnoses for a maniac patient. High risk for injury related to extreme hyperactivity, evidenced by lack of control over movements, high risk for violence or self directed or directed at others related to manic excitement or delusions and hallucination. Imbalanced nutrition, less than body requirement related to refusal or inability to sit still and eat, evidenced by weight loss. Impaired social interaction related to egocentric and narcissistic behavior, evidenced by manipulation of others and inability to develop satisfying relationship. Self-esteem disturbances related to unrealistic self-expectation. Impaired family process related to mood changes or refusal to accept responsibility for own actions. Now let us see nursing intervention for hyperactive behavior. So it is important to keep the environmental stimuli to a minimum, such as by assigning single room, limit the interaction with the patient, and also to keep lightings and noise very low. Remove all the hazardous objects and substances. And this is mainly because the patient may harm self and others. Assist the patient to engage in activities such as writing, drawing, and other physical exercises. This is to bring relief from a pent up tension and dissipate energy. Stay with the patient whenever hyperactivity increases to provide support and provide feeling of security. Administer the medications as prescribed by the doctor to relieve symptoms of hyperactivity. Now let us see nursing intervention for manic violent behavior. It is important to maintain low level of stimuli in patient's environment and to provide unchallenging environment. This is to minimize anxiety and suspiciousness. It is important to observe the patient's behavior at least every 15 minutes. This is to provide an early intervention to ensure patients and others' safety. Ensure that all the sharp objects, glass or mirror items, belts, ties are removed from the patient as this may be used to harm self and others. Redirect violent behavior with physical outlet such as engaging the patient in physical exercises like aerobics. Encourage the patient to verbalize and express feelings. Maintain and convey a calm attitude to the patient. Talk to the patient in a low, calm voice. Use clear and direct speech. Have a sufficient staff to indicate a show of strength to the patient if necessary. This conveys control over the situation and provide physical security for the staffs. Administer tranquilizers as prescribed by the doctor. If the patient refuses, use of restraint may be necessary. In such cases, a clear explanation should be given to the patient as to why the patient is being restrained. Following the application of restraint, it is important to observe the patient every 15 minutes to ensure the need for nutrition, hydration, and eliminations are met. Removes the restraint gradually, one at a time, to minimize potential for injury to patient and staff. Now, let us see some guidelines for self protection. Never see a potentially violent patient alone. Keep a comfortable distance away from the patient, at least an arm's length. Be prepared to move. Violent patients can strike out suddenly. Maintain a clear exit route for both the staff and the patient. Be sure that the patient has no weapons in his possession before approaching him. If the patient is having a weapon, ask the patient to keep it on a table or a floor rather than fighting with him to take it away. Keep something like a pillow, mattress, or blanket wrapped around arm between you and the weapon. Distract the patient momentarily to remove the weapon, such as by throwing the water on the patient's face or yelling. Prescribe antipsychotic medications as ordered by the doctor. Now let us see nursing intervention to improve nutritional status of manic patient. It is important to provide high protein, high caloric, high nutritious diet to the patient, such as finger foods that patient has difficulty sitting still long enough to eat a meal. Find out the patient's likes and dislikes to encourage the patient to eat. It is also important to provide adequate fluid for the patient, so provide 6 to 8 glasses of fluids. Maintain an accurate intake and output chart and caloric count, and also it's important to weigh the patient's weight. These are useful information to assess the patient's nutritional status. Provide supplements such as vitamins and minerals in order to improve nutritional status of the patient. Now let us see nursing intervention for manipulative behavior. Recognize the manipulative behavior and help the patient identify this. as understanding this behavior may facilitate greater acceptance of the individual. Set limits on manipulative behavior and explain the consequences if the limits are violated. These consequences for violation of limits must be consistently administered. Ignore the attempts by the patient to argue or bargain. This lack of feedback may decrease this behavior. Give positive reinforcement for non manipulative behavior to enhance self esteem and promote repetition of desired behavior. Discuss the consequences of patient's behavior and how attempts are made to attribute them to others. Also, help the patient to identify the positive aspects about self and to recognize accomplishments and feel good about them, as this will increase the self esteem of the patient. Now, let us see nursing intervention to improve self esteem among manic patient. Ask the patient how he would like to be addressed, as grandiosity is a thought actually to reflect low self esteem. Explain the rationale of ward routines, as nursing approaches should reinforce the patient's dignity and worth, and understanding the reasons enhances cooperation with regimen. Encourage the patient to verbalize and identify those feelings related to issues such as lack of control over self, as problem solving rather than victim. Allow the patient to set a realistic goal, as unrealistic goals will increase failures and lower self esteem even more. Encourage the patient to view life after discharge and identify the aspects over which he'll be able to control through a role play, as this will help the patient to enhance his self esteem. Now, let us see nursing intervention to improve family coping. First and foremost, determine the individual situation and feelings of the individual family members, such as guilt, anger, powerlessness, despair, etc. Because living with a family with such illness can foster a multitude of feelings and problems that can affect interpersonal relationship. Assess the patterns of communication in the family. For an example, whether feelings are expressed freely, who makes the decision, what is the interaction between the family members. This will provide cues about the degree of problems being experienced by the individual family members and also the coping skills used by them. Determine the pattern of behavior which is displayed by the patient in his relationship with others. Assess the role of the patient in the family, like the provider, etc., and how this illness has affected the roles of other members. Because when role of an ill person is not filled, family disintegration can occur. Provide information about the patient's behavior patterns and expected causes of the illness, as this will assist the family to understand the various aspects of the illness and will help to relieve guilt and promote family discussion of the problems and solutions. So in this video, we discussed about various nursing diagnosis and nursing intervention for a manic patient. Thank you.